Hello, this is Dr. Asena Paran. I'm the autism counselor of Stem Cell Therapy Clinic. I'm also a mother of a boy who was diagnosed 11 years ago. My son was diagnosed with Asperger's syndrome when he was 2 years of old age. So I was desperate, I was seeking solutions, and I was searching all rehabilitation programs and all over it, all over the world, like you. So my professors in my university when I was in medical school was working on this field. So I have discovered them, we have connected. So the result is my son is out of the spectrum now. That's why I was assigned as the autism counselor and the patient coordinator of Stem Cell Therapy Clinic. Our clinic has been implementing stem cell therapy for individuals with autism spectrum disorder for over 18 years, and we have had more than 3,000 cases up to date. What does stem cell do in this disorder? You know, autism is not a disease, so we cannot talk about a certain treatment, but we can talk about some therapies and some rehabilitation programs. Stem cell therapy is a very unique and also a very important rehabilitation alternative for autism spectrum disorder. Because, as I always say, in autism spectrum disorder, the individuals with autism have a formula race in their brain. They have a very fast stimuli, and there is no rule, there is no traffic lights, and there isn't any certain prevention and precaution of the brain. So accidents may happen in the brain. This may present with antisocial behaviors, repetitive movements, self-harming habits, picky eating habits, sleeping disorders, and many more. And you also experience some of them too with your child. When the embryo appears, when the sperm and the ovum combines in the mother's womb and get the embryo, a differentiation process starts. So the differentiation means a single cell, just a single cell, gets much and more and more and more, and very unique organs and systems appear. And after 40 weeks in the mother's womb, a perfect human body is created and gets out. So this is achieved by stem cells. Stem cells are mean cells with higher capability of differentiation and repair. But when we are born, they gradually get into a sleeping phase that we call the dormant cells. They get into a sleeping phase in our bones, inside our bones, and because the human body is born, so their task is accomplished. They completed their task. So our aim in the stem cell therapy is to awaken and to activate the sleeping stem cells, and then to get them out, and our professors process and obtain these rare, valuable, capable stem cells, and after then we re-inject it into the body of the child or the individual. And also after this, let's say in 3 to 6 months, we expect the child to get calmer, to have more words, to adopt social interactions much more, to get involved, to play with their peers and siblings. And also we expect milder cases, Asperger's, formerly we say Asperger's, and the other milder autism spectrum disorders, we can expect them to get out of the spectrum, like my son. So, autism is a long journey, and every family of autistic children is tired, upset, and sometimes we can feel desperate. So, but we have to be strong for our children, and we have to be strong for their future. And we feel responsible to seek every opportunity to get them better. That's why stem cell therapy may be a good option for you. Therefore, I always say, reveal the miracle inside your child out and give a chance to this unique opportunity of rehabilitation. You can contact with our patient consultants speaking your language for detailed information about stem cell therapy for autism spectrum disorder.